Hi, Amare Salutem here. We create videos to help support your wellness journey. In today's video, we're going to talk about some common questions I get about therapy and the therapeutic process. Currently in my work, I'm not practicing psychotherapy. I do work at a university and coordinate a program that helps students with learning skills. However, I am trained to be able to facilitate therapy, and I do supervise master's level students who are just learning how to perform therapy for the first time as a PhD student. So I'm not doing psychotherapy. I do refer a lot of students to the counseling and psychological services. A question I get from a lot of students and just people in general is about therapy, what happens in therapy, how do we know that it works? So I thought it would be helpful to just create this video and answer some of these questions, and hopefully they answer maybe some questions that you've had if you're considering therapy. This is my opinion too. I don't know every single type of therapy that's practiced, but this is just from my schooling and my practice, what I have seen. Question number one that I get a lot is who should go to therapy? My opinion, of course, is that anyone can benefit from therapy. It's not for people who are, for lack of a better term, severely mentally ill. So I did do my internship at a psych hospital, and actually I found that performing one-to-one psychotherapy in a psych hospital can be a little bit more difficult depending on the severity of the patient, because at that time they're usually going on medication and being adjusted for their medication. So that's not really where patients get one-to-one psychotherapy. And after the patient is discharged from the hospital, they're more stabilized on their medication. That's when they usually start the one-to-one psychotherapy. Therapists can work with you on the goals that you'd like to work on. Some people have goals or things that they know they want to work on in therapy. So for example, maybe having a difficult time with their spouse, and that's something that they want to work on in therapy. Or maybe someone has no idea. Maybe, for example, someone's displaying symptoms of depression and they don't know where to even begin. Goals don't necessarily need to be set in therapy at the start of the session. Sometimes it takes a little bit of time to get to know patient and therapist and establish rapport. Second question I get a lot is, how do I find a therapist? You can go many different routes. If you're a college student, I do encourage students to check their university first, because therapy is usually free. If you're not a college student, you might want to start with your primary care physician and see if they have any referrals. That's a good place to start. Or another place you can start too is just looking online. So I really like Psychology Today. You can search by zip code, and you can search by discipline and specialty and specifically what you're looking for in a therapist. So for example, some people might want a therapist that is very well versed in their culture, or maybe they want a therapist that's of their same gender. You know, there's a lot of different preferences, and luckily there's usually a therapist that can match up with anyone. Another place to look too is, even if you're not a college student, if you have a university nearby, you can check them out if they have some type of counseling program. They usually have some sort of free clinic. So for example, at the university I'm at, where I supervise the master's level students, that is a clinic that is open to the community. The only caveat to that is these are students who are being trained, but they are being supervised by a licensed practitioner. Next question I get a lot is, like, how does therapy work? You have a lot of forms to fill out before you actually go into your therapy session. Generally, the forms are just to get some background information about you as a person. Sometimes the first session is where you meet the therapist, and then they go over some questions in person, and then you fill out the form together. So it's kind of the therapist is getting to know you, getting to know some background information, maybe what you want to work on in therapy if you know, kind of setting some ground rules for therapy. It depends on the therapist's background and how they approach counseling. With more of a person-centered approach, usually there's more time spent on building rapport with the clients. and fostering that relationship, which is really important in order for the client to feel comfortable with opening up in some cases, because it can be very vulnerable for someone to open up and talk about really personal things with someone that they don't really know too well. So spending that time building that rapport is really important. And that's how I was taught to always start with a person-centered approach and then kind of use different techniques and theories. I go by kind of like an eclectic approach. Might use, for example, CBT, Gestalt, might use person-centered, maybe some behavioral techniques, and use them as needed for the client in needing to adapt. There is some research that shows that some therapeutic techniques work with certain populations better than others, so I think it's important for us to be mindful about that. But then also at the same time, looking at everyone as an individual and not just putting people into boxes based on whatever cultural background they're from or their age or their gender or things like that. So it's definitely a balance between those things. Most therapists are, at least nowadays that are being trained, are proficient in multicultural approaches, which is more of an eclectic approach. Well, how does therapy work? I'm just talking to this person and like, how is it doing anything? I can just talk to anyone. It's not just talking to someone else. Therapy should not be just coffee shop talk is what we call it, and we call a lot of master students out on that when they're in training, because that's a common thing that a lot of people fall on when they think of what therapy is. They think, yeah, I'm really good at talking to people, or people come to me with their problems. Therapy is not solving other people's problems or giving advice. You're not going to find a therapist that's going to give you advice, because a goal of being in therapy too is to empower the client. We have the tools and techniques in the future to be able to make those decisions and not to be dependent on the therapist to have to answer questions. So I think that's really important. And I've seen a lot of clients that get frustrated because they want that advice, but the therapist is not there to do that. The therapist is there to help guide the client towards making decisions and allowing the client to be held responsible for whatever decisions that they make. There are theories that the therapist is using, evidence-based theories. These are based in research. These techniques have been researched to show that they work. Right now, a very common therapy is cognitive behavioral therapy, CBT. This is really popular because it has a lot of research backing up that it does work in a lot of different types of clients, a lot of different diagnoses. So your therapist, I'm kind of switching around here, but will make some sort of treatment plan. This isn't something that you'll see, but the therapist will talk about what you went over, what your goals are, what therapeutic modalities they're going to use in the treatment. This treatment plan might change, it's flexible, but after every session, your therapist is writing notes and checking in on your progress too. If your therapist didn't do that, then it wouldn't be as effective, because it's important to check in with your goals and make sure that client is moving along and growing. If not, then it would be unethical to continue in that way. Something needs to change. Therapy kind of continues then based on the treatment plan is kind of the model for how it goes. And then most insurances pay for around 8 to 10 sessions per year. It really depends, but if you are concerned about the cost, I'd really recommend checking in with your insurance company first before going to therapy. It's always good to stay on top of that, and if you are concerned about it, let your therapist know up front, and you want to know about the cost and what can you do to find that information out. How does therapy end? It's kind of a decision that you and your therapist make together. Unfortunately, yes, sometimes it is how much the insurance company will pay for determines how long the therapy sessions will be and when it will end. However, the therapist won't necessarily know that, so it's again important to make sure that you're aware of how many sessions will be covered. And so there is that, communicate that to your therapist. It could be when your goal is met, that might be time to terminate, and if there's not an immediate goal that you want to work on right away. That might be time to terminate and see how you're doing off on your own. And if you feel like you need to come back, you can always come back to therapy. Usually therapy sessions meet once a week, but then if you are interested in terminating, or you're complete with your goal, if you want, you can have some kind of follow-up sessions that might be every 2 weeks, and then maybe every month, and then it kind of tapers until eventually termination occurs. A lot of the therapeutic work comes outside of therapy. A lot more time that you're not meeting with your therapist than you are to work with your therapist on coming up with some goals or maybe some things to work on outside of sessions. And again, that kind of comes, I think, more with the CBT approach. That's, again, what I learned. Usually therapists don't just give homework. It's a collaboration between the client and the therapist and what the client wants to work on in between sessions. Something else to mention is that therapy can be a difficult process, especially if you have a lot of things that you haven't talked about, you haven't faced, that you've been keeping buried down, or maybe you don't even realize it. I had a client that had some things that they didn't even realize they were carrying around for like 20 years until they started the therapeutic process and kind of remembered some memories from a long time ago. And so we were able to talk and process with that. So there's a lot of processing going on of feeling, and sometimes it's just, being in that moment with your feelings and processing them and feeling them. If it feels uncomfortable, I say expect that, because if you're going to have any change, it's going to be a little bit uncomfortable in the beginning. It's about how can we have tools and techniques to be able to manage these feelings. That's all I have for now. I think I talked a little bit more than I expected to, but there's so much to talk about. It didn't even cover even a dent. So this was a very small dent in everything that I could have talked about. If you're interested in learning more, please let me know in the comments, and I can create another video. If you have specific questions, I can create a video based on that too. So I hope you liked this video. Thank you so much for sticking around and watching. There'll definitely be more wellness videos to come. So have a great rest of your day and take care. Bye.